understand where we are, we need to know where we started and how we got here. Back in 2005, I had the honor of being appointed by then Executive Vice Chancellor and Provost Gene Washington to chair a task force on community partnerships. And this is the report we produced. Now, you know this is history because it was actually a printed report in this binder and not just something that you carried around on a digital format. And what this task force called for was creating a central entity within UCSF to help facilitate and support and coordinate our engagement with community members. And there was a strong message that many people, particularly in under-resourced communities, saw UCSF as the ivory tower. It was inaccessible. It was not responsive to community needs. We heard on the research front about drive-by research. People from the university would come in, do a study, people in the community would never even learn the results of that study. We had a forum with community members, and a gentleman stood up and said, "Why do you call us research human subjects? Are you our kings and queens? We're participants. We should be treated and referred to with more respect." So this was the landscape 20 years ago that said we need to do things differently. We called for a radical notion at the time, that there should be a governing council that consisted half of members of UCSF and half of community members that would have shared authority over governing and directing this new Center for Community Engagement.
Through transitions across various UCSF offices, CCE has remained steadfast in its purpose to build relationships that are lasting, impactful, and equitable.
Together, we've tackled critical issues such as sugary beverage, alcohol policies, children's oral health, cancer, and COVID-19 response efforts. We are at a crucial time in our country with respect to health promotion and health research. We have to understand what our communities want and work together to address our challenges in the current climate.
The Stop COVID CEAL Collaborative was a powerful example of multi-community leadership and partnership, and how we must leverage both the prestigious science of UCSF and the institutional humility to recognize where community trust is strongest and persists in challenging times. Just one example of how UCSF has learned to value how community wisdom and resilience truly advance health.
Health equity is our commitment to ensuring that all our patients have the opportunity to achieve their optimal health. Through partnerships in the tri-annual Community Health Needs Assessments, we elevate community priorities to shape UCSF Health's plans. We actively engage patient and family voices to ensure that healthcare reflects the diverse needs of the people we serve.
Community engagement is vital for opportunities and outreach because it moves beyond tokenism. This advances excellence here at UCSF, as well as within the communities we serve. One pillar of the Anti-Discrimination Initiative is a commitment to the Bay Area. This pillar focuses on supporting local youth and their families by fostering and supporting curiosity in STEM fields, and by offering meaningful job opportunities. We help young minds build a strong foundation for their future academic and career success.
Education is one of the most powerful tools we have to foster health and well-being for all. Through diverse community-engaged learning opportunities, such as electives, student organizations, and student-run clinics, we have mentored generations of learners, empowering them to engage directly with communities.
As one of the Bay Area's largest employers, we create pathways to economic growth and stability through workforce development, small business partnerships, and community investments. These efforts demonstrate how institutions can uplift communities, improve economic outcomes, and promote long-term health benefits.
It's essential not only to highlight CCE's measurable accomplishments, but also to emphasize the transformative changes in systems and culture that support this work. These impacts remind us that change happens when we work together with shared intention and commitment.
The support for this work at UCSF has been truly significant, especially given the challenges that the institution has faced over the last several years. We've moved beyond just being a good neighbor to being a vital member of the community who promotes the health and well-being of all its residents. On behalf of CCE, I want to express our deep gratitude to Chancellor Hargood for stepping up to the plate and being a champion for this effort. We propose a bold vision for the future, a healthy Bay Area and beyond, where everyone has access to mental and physical health and meaningful lives.